Hello, I'm Dr. Michael Polcino, and this is a Dr. P Minute. Soon we'll be approaching a Breast Cancer Awareness Month, and I think it's important for us to look at the numbers. 1 in 8, or 12% of all women, will develop breast cancer during their lifetime. With those high numbers, I think every month should be a Breast Cancer Awareness Month. Where does cancer start? Cancer starts with a cell in the breast that undergoes a mutation and starts to divide uncontrollably. Usually, your natural immunity will take care of it, but once in a while, a cell can escape, and that's where the cancer can start. We know that to get the best cure rate, we want to find cancers very early. And so, the American Cancer Society advises us that mammograms are the most reliable to find a cancer early. Mammograms are a low-dose X-ray of the breast, which can find a lesion that's only 2 to 3 millimeters. Remember that 75% of all breast cancers are found with mammograms when women have no symptoms at all. So what are the symptoms? The number one symptom will be a breast lump. You could also have bloody discharge from the nipple. You could have changes in the skin of the breast and the nipple. You can have redness and pain. What about risk? We know that risks increase with age and with genetics. So if you have a family history of breast cancer, there's an increased risk. The American Cancer Society advises us that if you have 1 alcoholic drink a day, that increases your risk by 10%. And if you have 2 to 3 drinks per day, it increases it by 20%. Weight can also be a problem. If you're menopausal and overweight, that increases the risk because the fat cells will secrete estrogen. Also, in your system, there'll be elevated insulin, which can affect the breast cancer. We also know that if a woman has not had a baby by age 30, or she has no children, that increases the risk. But if you nurse for greater than a year, decreased risk. Lastly, let's talk about screening. Sloan Kettering, the world-famous cancer center in New York City, advises to start self-breast exams at age 20. You should examine your breasts monthly, after each period, or the first day of the month. You should also look at your breasts because you'll be the first one to see any changes. Sloan Kettering also recommends to have a yearly exam by a healthcare professional starting at age 25. Turning to screening mammograms, they recommend mammograms to begin at age 40. If the mammogram reveals dense breasts, then you should have a yearly sonogram because dense breasts can obscure small lesions. Some centers also recommend having a screening baseline at age 35. Remember, screening mammograms are for women who have no symptoms. So please speak to your healthcare provider and establish a breast care plan for yourself. I'm Dr. Michael Polcino. Hope to see you soon.